The Charity Fund for the Support of Social and Cultural Initiatives of Leyla Damian presents Problems of Transitional Period: How to Preserve Reproductive Health, Youth and Beauty. Moscow, the 3rd of September 2017. I would like to remind you that right now we're going to attend a scientific and practical conference organized by the Charity Fund of Leyla Damian and the Open University of Leyla Damian. This scientific and practical conference is titled Transitional Period: A Woman After 40 Years Old. People who were not able to come here can watch us over internet, and there is a TV set in front of me, so I can see very well what we're saying, how we're saying it, and what we look like. Our next speaker is Dr. Lyubov Vinogradova, Methods of Fertility Restoration. Please do not dwell on the causes too much, but rather present us today's achievements of in vitro fertilization, IVF. The floor is yours. Thank you. I'm taking this floor to tell you what we can offer to women who are over 40 years old. It has already been mentioned that a woman of yesterday and a woman of today are women of different epochs. In the past, women were trying to have children as early as possible. Today, many of us are trying to build our career first, actualize ourselves, and only then we think about bearing children. We must recognize that after 40 years old, things are not so simple and safe. The changes in the secretion of reproductive hormones, reduction in the ovary reserves, deterioration of egg cells, all of them diminish the chances of becoming pregnant both naturally and through in vitro fertilization. Now, what is fertility? It is the capacity of the body to reproduce living generation. Infertility means absence of pregnancy for a year of a regular sexual life without protection in women younger than 35 years old. It should be noted that this period is 6 months in women after 35 years old. In women after 40 years old, infertility and the chances of becoming pregnant are unfortunately much worse, even when using the IVF methods as well. I'm not saying that a woman after 40 cannot become pregnant naturally. Of course she can, but we often run into problems that require high-tech solutions. The main methods of infertility treatment in women after 40 years old include screening for somatic and gynecological illnesses, evaluation of the ovary function, if that's possible, preparation for natural pregnancy, or planning the IVF program. If the ovary reserve is low, fallopian tubes are blocked, spermatozoids do not perform their function, this is no doubt an indication for the IVF program. If we do not see any pathological situation, then a woman is referred to having natural pregnancy, but for not more than 6 months. I would like to say that the frequency of gynecological illnesses increases along with a woman's age. We run into problems such as tumors, hyperplasia, endometriosis, etc., and a great assistance is offered by the pre-surgical preparation of women, both for natural pregnancy and for the IVF. Thin endometrium is one of the most frequent problems that we encounter. In this situation, the embryo fails to become implanted. Thus, we use estrogen medicines, vasodilating medicines. Another very helpful treatment, which is currently under research, is a colony-stimulating factor, which is transferred into the uterine cavity and improves the endometrium receptivity. If none of these measures which I mentioned are effective and the woman does not become pregnant, then she is referred to a fertility doctor for additional reproductive procedures. These include artificial insemination, in vitro fertilization with possible microinjections of spermatozoids to the egg cell. Other methods are oocyte donation, surrogacy, genetic screening. What is in vitro fertilization? We speak a lot about IVF. It means fertilization outside the human body. By today, more than 7 million children were born after in vitro fertilization. The ovary reserve was discussed a lot today, so I'm not going to focus on that in detail. The quality of oocytes after 40 years old unfortunately deteriorates. The aneuploidy becomes frequent. What we can offer to improve the quality of egg cells? We can offer dehydroepiandrosterone drugs. We can apply growth hormones. We can use melatonin. All of these measures are being discussed and applied, but unfortunately, this has not become a widely used practice in medicine yet. The main and most effective method that we can offer a woman for improvement of the pregnancy chances is the embryo genetic screening. It means a pre-implantation genetic screening used to analyze the embryo before transferring it to the uterine cavity. The history of genetic screening is quite long. In the past, we were able to assess very few chromosomes and sex-linked diseases. Today, we are able to do comparative genomic hybridization, and this method is used to analyze the whole DNA molecule, including mosaicism. The main and most frequently used patient protocol is the standard protocol with antagonist, when the stimulation with gonadotropin starts on day 2. Then antagonists are used with ovulation triggers and egg cell puncturing, fertilization, and on day 5 of embryo's development, trophectoderm biopsy is conducted. In other words, a piece of embryo's membrane is taken for genetic screening and embryos are put to cryopreservation. After receiving the results of the genetic screening, we determine which of these embryos have a normal karyotype and may be transferred into the uterine cavity according to the cryo protocol. As for women after 45 years old, unfortunately we can offer only oocyte donation without the possibility of selecting a normal native egg cell. Today, surrogacy and genetic material donation are widely used in Russia. Some European Union countries have banned this type of measures, but our country widely uses that method. Another method that was mentioned during the first presentation is uterus transplantation with subsequent bearing of a child, which was done in 2014. However, this is a very rare case, which is a case study in fact. I would like to say a few words about obstetric complications in pregnant women who are over 40 years old. Unfortunately, we do happen to run into obstetric complications such as placenta previa, frequent premature delivery, hard gestation course, etc. This is why women should think about planning to conceive and bear children well in advance. Another method for improving the effectiveness of infertility treatment and implantation of embryos in the uterus is assisted hatching, when a laser is used to make small cut right before the transfer of the embryo into the uterine cavity. This way the embryo can hatch more easily from its membrane and it becomes implanted in the uterus better. In conclusion, the IVF program is the most effective for women over 40 years old, when their own oocytes and genetic screening may be used. After 45 years old, the best method are oocyte donation and surrogacy. Remember that you can store your genetic material beforehand. If you're not planning pregnancy now, if you have a career, studies, some perspectives and plans, just think about when you would like to have a child. Maybe we will be able to help you by preserving your genetic material in the cryobank and using this material later when you're ready for it. Thank you very much. Thanks a lot. You can see, dear friends, that one topic flows into another. Thus, you will soon be able to see the whole problem of the transitional period. Till the next meetings at the conferences of the Open University of Leila Adamyan.